Good evening. It's our Wednesday night product experience and training call. My name is Keith Hooper. I'm here in Central California. We're joined this evening by our good friend Dr. Barry White out of Ontario, Canada. This is a call that we do every week for Immunotech distributors where we share information about the products from Immunotech. And once again, we want to put the caveats in that the products from Immunotech do not cure anything. But as Hippocrates said some 2,500 years ago, let food be thy medicine. And simply the most important food you can use is Immunocal and Immunocal Platinum. And we're going to cover a lot of great information tonight. As of about 30 seconds ago, there was an email that went out of the system that you got, that all of you that get the emails where you've registered on xyztools.com, there's an email coming out, and there's a link to what Dr. White and I are going to be talking about here tonight in just a moment. Good evening, Dr. White.
Good evening, Keith, and everybody else, of course.
Oh, I tell you what, it's you and I have had some interesting conversations in the last day or two. You know, it's interesting because all those years ago when Sandra and I came to Immunotech, there were three things that stood out to me. And at that time, when this was a couple of months before Immunocal became available to the public, but there was already a patent of use on Immunocal as an immunotherapy for the treatment and prevention of cancer. The animals that were fed Immunocal lived 30% longer than those that weren't, and that had already received a generally recognized as safe by the FDA and the same type of classification in Canada, which means the product is safe to use every single day for all of our lives. So, you know, Dr. White, 1992 or 1993, I believe that patent was issued on Immunocal as an immunotherapy for the treatment and prevention of cancer. Am I right on that?
Yeah, 93. And the interesting part was, in Dr. Summersall's book that has about Dr. Bunos and so on, it was in that they recognized that Dr. Bunos could be in line for a Nobel Prize for this magnificent discovery. And it hasn't been issued so far. It may have got issued to somebody else. But the whole part of this was exciting news that a food could be used as an immunotherapy. That's just magnificent, you know, astronomically magnificent.
Well, and when you read the patent, as you pull up that patent on Immunocal, and there's a number of them, so you know I didn't put a link to the specific patent, but what's interesting when you read that patent is what it talks about is that it raises the glutathione levels in the cell, thereby you know, activating the T cells, which, you know, are the killer cells for cancer. And yet it normalized it so you didn't have an abnormal response from it and all the stuff that's in there. It's very complicated as you read the patent. But that's what this patent was issued on, which was the treatment and prevention of cancer. You know, we've looked at all of the years that we've been here with Immunotech, and people have taken Immunocal. They've had serious health challenges. We're going to talk about cancer tonight, folks, because this call is intended for the exclusive use of Immunotech distributors. This is a training call. This is not intended for customers. This is not intended for people that are thinking about joining Immunotech. This is information that we share here because, you know, you don't need to know an awful lot to buy insurance. You don't need to know an awful lot to buy insurance. But if you're gonna market insurance or sell insurance, you need to be well informed, and that's what these calls are about: is being well informed on the nutrition side of what we have here with Immunocal. So, all those years ago, you know, we have this immunotherapy. No one knew what that word was. You know, immunotherapy. What are you talking about? It's just an oblivious word out there. But over the years, we've seen, you know, people take Immunocal. They've had cancer. They've had these other health concerns, and they get a very, very positive response from that, of taking Immunocal. And, you know, once again, the scientific part of it is back to the patents of raising their glutathione levels, you know, activating their immune system to do what it's supposed to do, Dr. White.
And that's the crucial thing about this. It sounds simple. It is very complex, but it sounds simple.
Yeah,
and the simplicity of this is simply this, that when you have an immune system that's ready and willing to work on your behalf, it can take care of all sorts of things, including the cancer part, or viruses, or tumors that are not cancerous. But there it is, sitting on the shelf, ready for you, and it was developed strictly because of an inquisitive mind and a superlative skill of Dr. Bunos those many years ago.
Absolutely. So, we look at this, and I go back to the conversations that I had with Dr. Bunos. Immunocal, our cancer is a result of an overwhelmed immune system. Those were his words to me. Cancer is a result of an immune system that's overwhelmed. Now that can be, that can be because your immune system is weakened and you're exposed to some kind of a carcinogen that if you had a normal immune levels, it wouldn't be that. Or it could be something where, you're exposed to something that just literally is going to overwhelm your system regardless. Okay, so, there's a number of issues there, toxins and, maybe you're exposed to some type of radiation or whatever it happens to be. But the idea was, that Dr. Buno said, is that, if your immune system operates properly, because as we've talked about, there's about 1.5 million cancer cells in anybody's body on any given day that's engaged in mortal combat with your T cells, Dr. White. You've spoken to this often.
Yep. 500,000 to 1 million are produced every single day within your body. Sometimes it's just cells that go awry and don't get formed properly. They come from the stem cells, which you've probably heard about, and they misform. It can be from the radiation and all sorts of things like that. But nonetheless, every day, 500,000 to 1 million brand new cancer cells are in everybody. This is not an occasional person that gets cancer. It's in everybody. And you need an immune system that, like a Pac-Man, just gobbles those cancer cells up and destroys them. That's what's happening every single day in our body. It's war, people. It's war that's happening inside because your immune system are the soldiers on your side.
Absolutely. So, what we're gonna move to another segment here, Dr. White, on the same vein. Because the Nobel Prize in Medicine was just awarded to 2 doctors this last month, and it's really kind of interesting. So I want everybody to keep this in mind. 1993, there was a patent issued on Immunocal as an immunotherapy for the treatment and prevention of cancer. We now go to either September or October. I'm not sure exactly when they gave out the Nobel Prize in Medicine, but it said the headline of this article that the people that get the emails regarding this call, you just got it in your email or will be getting it shortly. There's a button there that you can press and you can open up a PDF of this, what we're talking about here. But the article's titled "A Cure for Cancer: How to Kill a Killer." Revolutionary work on the body's immune system and a host of new drug trials mean that beating cancer may be achievable. Last month, the Nobel Prize in Medicine was awarded for 2 breakthrough scientific discoveries, heralding as having revolutionary cancer treatment and fundamentally change the way we'll view how cancer can be managed. It goes on. The Jim Allison for his breakthrough advance in cancer immunotherapy. His discovery had resulted in the transformative outcome for patients and a radical new direction for cancer research. This is they think this is new stuff, Dr. White.
It appears to be new in the eyes of medicine, but here we are more than 20 years ago, having already put this on the market for us. And we who have had, I've now had it for 21 years, and my battle for cancer is being won every single day because I use Immunocal Platinum in my regular dietary choices.
So, it's amazing. So once again, I'm going to encourage all of you that get this, open that link, print it, so that you can read this entire article, because it's very, very interesting on what they're doing. But what they're doing is one of the things that they're doing for this cancer treatment. Now, once again, they're dealing with people that are at stage 4 cancer. They're introducing a substance that supercharges their immune system. One of the things that Dr. Bunos was concerned about was that you didn't want to do that. Okay, you did not want to supercharge your immune system. You wanted to normalize it. And once again, what we have with people is it's after about the age of 25 or 30, your glutathione levels start to go down. When your glutathione levels start to go down, you do not have an optimized immune system. You take Immunical and you can optimize your immune system, not supercharge it. But you know, Dr. White, as we read through this and looked at the things that were here, one of the things that they finally admit in here is that the cut and burn and poison is at best 50% effective. What they've been doing, the cutting, the burning, and the poisoning, okay? So the cutting out, the radiation, and the chemotherapy is at the very best, 50% effective. That's what I mean. That really stood out to me.
I think they actually misplaced the decimal place, and it's closer to 5%. But nonetheless, we'll let them have the 50 in the article.
Right. So it goes through there. I mean, we're going back through this. So like I say, everybody will have received this in just a few minutes with this. But, you know, for us with Immunotech, when what you have here, when you start to talk about immunotherapy, and someone says, well, I don't know what you're talking about. Well, they just awarded the Nobel Prize in Medicine, as it's the killer of cancer is immunotherapy. The patent on Immunical is an immunotherapy treatment for the prevention and treatment of cancer. Key word, I think, Dr. White, to that patent is the prevention part. Okay.
Yeah. And here's the interesting part about the patent. It doesn't specifically talk about cancer A, because there's more than 300 different kinds of cancer. It doesn't talk about a specific one, which these chemotherapies are often targeted to take care of one or two or three of the many 300 and some cancers. This was a blanket. It was in general, when you raise your glutathione with Immunical or Immunical Platinum, it's a blanket to make sure or give you the best possible chance of killing all those cancer cells that are developed every single day. So it's a generalized thing, and none of these breakthrough things, which each of these treatments cost $1 million, and sometimes they have enormous side effects, toxic side effects that can kill the people as well. But those treatments are $1 million. And here we are. Sometimes people occasionally complain about a $100 retail dollar for a package of Immunical compared to $1 million. Wow, we are getting the greatest bargain on earth by comparison.
Absolutely, and once again, as those of you that get the email, as you scroll through it and read it, and I do really recommend you print it off and get it. This will not be available anyplace else, and that link will disappear as of probably Friday. So if you haven't printed it off, you won't be able to get it. But what I thought was interesting in this article, because once again, what do we know about Immunical? Generally recognized as safe. What does that mean? It means that the government has determined because of the test results that you can take this product every single day for the rest of your life. What do we know with 23 years of people using Immunical? That they get the positive results. But what this tells you when you read it is it gives you, in layman's term, because this is not a medical document, this is more like a press release, but what it really does is tell you why the people taking Immunical that have cancer, that have these other things, why they're getting the positive response and what's going on here. But what's interesting with this scientific breakthrough that they gave the Nobel Prize in Medicine for, okay, guess what? It's not Immunical. It's not the precursor for glutathione. They're actually taking out your red blood cells. They're manipulating them and turning on the T cells and and blocking the off switch where they won't turn off, and then re-injecting it back into your body. And as it says, immunotherapy is not a free ride. There are toxicities that occur with T cell responses unleashed. Okay? That's one of the things that's key. We don't have that, but they do with this cancer treatment. The other thing, there is also the economic toxicity of bespoke cancer treatments that being about durable remission, but cost upwards of $1 million. $1 million for the patient. Okay? So, this therapy may be out there. This therapy may become available. Do you really think your insurance company is going to pay for it? I don't. Okay? In fact, I can guarantee they're not going to. Okay? And that's a bold statement. But it's $1 million. And so when you just do the math, I was watching something, Dr. White, in the province of Saskatchewan, there's 54 people a day being diagnosed with cancer. So if you looked at that, it would be a drain on the province of Saskatchewan of $54 million a day just to treat cancer. $54 million a day just for this one treatment that would be on that budget. Okay, that's $1.5 billion a month. You're looking at $18 billion a year just in the province of Saskatchewan for this treatment. Or somebody could take a couple of packages of platinum a day. Which one do you think is more likely that people are going to benefit from, Dr. White?
I would guess if they understood, well, all we have to do is say, yes, let's go find out. I mean, that's that simple.
Right. Yeah. But I also think that at the very end of the article where it comes down, several doctors tell me that the goal of treatment, if a cure isn't possible, is holding on for the next breakthrough. And if and when it comes, here's interesting, patients and doctors need to be ready to understand it. After all, says Chin, there's nothing more useless than a therapeutic breakthrough against cancer that people don't know about. 1993 patent of use issued by the United States government on Immunical as an immunotherapy for the treatment and prevention of cancer. I don't know what the dates were in Canada, Dr. White, but I'm assuming they were 1993 as well.
Yeah, it's the same, yeah. And just to understand, this is a medical patent, not a formulation patent. It's unique in the use of food and so on. There's only two basic patents. One of them has to do with Mini-Cal, and the other has to do with our Serenity. But those are medical patents and nothing else on the market. No place, no matter what they say, there's no other patents like this on any other product in the world.
Absolutely. So once again, I'm going to open the lines here in just a moment, but I do want to put the caveats again. This is intended as a training call for the exclusive use of Immunotech distributors. It's not intended for potential distributors or customers. This is a training call where we can open and talk freely about it. The products of Immunotech research do not cure anything, but as Hippocrates said some 2,500 years ago, let food be thy medicine. Once you think about that, Immunical doesn't cure anything. What's the patent say? For the treatment and prevention. That's what I think is most powerful, Dr. White. Before I open the call, any thoughts you want to add?
Yeah, just in general, when a person is diagnosed with observable cancer, and the smallest tumor that can be detected, for example, in breast cancer, is 3 million cells. That's the smallest we can detect. When that is detected, all right, as soon as I hear that word, I say 4 packages per day of Immunical, preferably 2 Immunical, 2 Platinum, but nothing less than the 4. Something less than 4 may slow it down, but with the 4 combination, and can even be 4 Platinum, is your best chance for getting ahead of it. A lady just called down below, and she's got observable cancer. She's been taking 2 packages, 1 plus 1, of Immunical and Platinum, and she's the doctor keeps checking her monthly, and the markers are going up slightly, and she's not at any risk, and the doctor doesn't need to do any chemotherapy yet. And I simply say, get ahead of it. Go for the 2 plus 2, and see if you can't cut that off and get the markers to go to drop back as well. So that's just a general comment. 4 packages a day are needed in order to get ahead of cancer.
Absolutely. So once again, this call is not to be recorded, captured, done anything with. other than as for the training, and we'll do some other things with it possibly. But once again, we wanted to share this information. I'm going to open the lines up here, so if you're somewhere that's noisy, you can hit *6 on your phone right now. And before I open the line, so if you know you got background noise and you don't have a mute button, you can hit *6 or mute your phone right there, and we will open the line. Okay, the lines are open. Who has thoughts, comments, or questions tonight? Let me go to Dr. Skipstead first. Dr. Skip, you were listening there. I don't know if you're available. Let me see if you're with us.
Yes.
I mean that I think is just so profound that they've issued the Nobel Prize in Medicine to some people for immunotherapy. We've had this product since 1992 or 1993, a patent on it, and you were a beneficiary in 2009.
That's right.
So
I was actually diagnosed by MRI having a 2.5-inch spiculated mass on my lung, and actually it was concurred by 4 different medical doctors who saw the images that was taken down in Scottsdale, which was the branch of the medical treatment from Mayo Clinic, and that's very, very qualified. And actually, by taking nothing else, no chemo, no radiation, nothing else, but taking Immunicol, within less than 3 months, my total mass was reduced down to the size of my little fingernail.
Yeah, it's so interesting because once again, when you read this article that just came out, you'll get a feeling of why Dr. Skipstead got his results. Some of you may recognize the name President Jimmy Carter. Okay, President Jimmy Carter had either stage 3 or stage 4 melanoma. I'm not sure. I think it was stage 4, and he went through experimental treatment. Well, guess what it was? It was exactly this. It was this immunotherapy. That was another article that I read today.
Cool. Wow.
And that's why he is cancer-free today. This is what what this research that they're doing is they're only taking stage 4 in what they're doing. They're only taking stage 4 patients for this, but it's $1 million. But I mean, we're really excited about this. And once again, and everyone that's on the call, everyone that's an Immunotech distributor, this should be something to really embolden you when you're talking to somebody. Not in my words, not to take any guff. Okay, I'm sorry, you don't get to have an opinion. Okay, if we have a patent of use issued by the United States government and they just issued the Nobel Prize in Medicine on immunotherapy, I'm sorry, you don't get to have an opinion. Take the Immunical or you're going to suffer the results. That's what you're talking about, because you're not going to get that $1 million treatment. Okay, because it's not even available. Okay, you can't even find an oncologist. The chances of you finding an oncologist that can even get you in a trial, if you were capable of it, is slim and none, because there's only a handful. Okay, so it's that's why when somebody says, well, gee, I don't know about Immunical, whatever. Well, yeah, you don't know. And that's where you want to be emboldened. So anyway, before I get too far down the rabbit hole and make everybody mad, let me see who else has thoughts or comments or questions tonight.
I have a question for you, Keith. Are you there?
Yeah.
Keith, this is Scott Black. You and I are supposed to connect. I apologize about that.
Okay.
I'm with Judy and
Right.
Dr. Skip. I have a radio show. But anyways, my mom just died from cancer on Saturday. So my dad died in February. My mom died on Saturday. And so I've been taking Immunical. I don't see a doctor or anything. I've been taking Immunical now for about 3 months from Dr. Skip. And, I'm pretty active. I put in 24-hour days. I'm 53 years old and don't see a doctor. But I don't know what it's doing, but it feels good. But I want to make sure I'm doing it right. A couple things. I heard the doctor talk about taking 4 a day. I've been doubling up. But let me ask you, the 30 minutes before you eat, an hour after you eat, I mean, how hardcore is that? I mean, if I'm off by a couple of minutes, does that mess anything up?
It doesn't. I get up in the morning. I take 2 packages of platinum every morning, okay, as I start my day. I take 2 platinums. I take all the other. I take the calcium and the omegas and the vitamin mineral complex. I put a little I actually put. I take my Immunical Platinum. I put a little bit of water in. I put a little bit of cherry because I like the way it tastes and it helps a little bit, I think.
Mm-hmm.
So I add a little bit of cherry with it. I put my 2 packages of platinum in it. I open my optimizer, put it in, and take it. And that's when I'm at home and I go about. If my wife and I are traveling, I do it at the breakfast table as I'm waiting for them to bring me my breakfast. Now, we hear people that talk about taking, it's a great question, Scott. I really appreciate that and really looking forward to talking with you. Is there a difference taking it on an empty stomach? There may be, but I don't know that it's measurable. What I do know is I sat with Dr. Gustavo Bunos, who developed the product, and Dr. Patricia Cockshaven, and they took it with their breakfast. I sat with Dr. Wolf Droge, and he took it with his breakfast. Okay. Now, once again, because when you got the bioavailability of the protein that's delivering the building blocks to make the glutathione is 30% higher than eggs. Eggs have a bioavailability number of 100. It's not a percentage. It's 100. Immunical and Immunical Platinum, the protein is about 140 or 150. So it's the most bioavailable that you have. Once you take it, okay, you will have consumed all of it, and it will be in your system in less than 20 minutes.
Okay.
So it's like I say, there are those that are purists. We hear it all the time. Dr. White, you want to add to that?
The concept is competition of proteins in your stomach. It's a small protein, so it doesn't need digestion and it gets through quickly. So that's why it works so well. If you want to be more a purist kind of thing, separate them by a few, 5 minutes, 10 minutes, doesn't matter. All that will be helpful.
Okay, and because there's sometimes I haven't taken it because I don't want to waste it. I'm just telling my own thinking. My own thinking is because of the bioavailability. My own thinking was if I have something else in there, that's going to offset it. So I've actually not taken it a few times because I couldn't get my eating schedule down. So I just want to make sure how hardcore that was. That's all.
No, you can take it. You can take it there as you're having your breakfast. You can take it with your lunch. You can take it with your dinner. Whenever it's there. I mean, like you say, ideally, sure, if there's 10 or 15, 20 minutes separation before you eat, that would be great. But it's not. Once again, it goes back to the point of taking it and taking it consistently every single day.
Awesome. Well, I do that, and I'm going to be planning on reaching out to you tomorrow.
Okay,
I'd like to spend time with you next week, so I'm looking forward to talking to you.
All right. Well, thank you for being on the call. Thank you for the question there. Like I say, that is a big question people have is, the regimen. Okay. That's one of the things that we do not stress enough. This product is convenient. The number one product in the U.S., I'm assuming it's the same way in Canada and the rest of the world, quite honestly, is convenience. That's why there's drive-thrus. Okay, it's not because they're giving you healthy food. If it's a drive-through, it's probably not a healthy place to go, but because of the convenience. One of the things, that's the thing you want to think about with Immunical, is make it as convenient for people to use. And once again, and in your own life, is it convenient? Okay, I mean, I took two Immunical Platinums this morning, and because of the situation that's going on right now, it seems like we've got a little bit of a flu situation going on here in Central California where I'm at. I took 2 Immunical this afternoon about 4:30, okay, or so, 4:30 or 5. I took 2 more, and I did the same thing yesterday. And, once again, I'm not doing that because I think I'm going to get an immediate response from it. What I do know is that, if I'm under attack, you're not going to know it till it's too late. Okay? So, my next door neighbor, okay, was sicker than heck for about 4 days. Okay? And he said it was probably the sickest that he's been in years. Well, I don't want to participate in that, and so that's why I'm taking those additional packets. And that's one of the things that I do. I take 2 platinums every single morning, every single day, 7 days a week, 365 days a year, okay? Because I brush my teeth every single day, and I do it before that, okay? So it's one of the things that I do every morning. So, but that I take the additional Immunical only occasionally. If I start to feel something coming on, you bet, I'm taking 2 more, okay? If I'm in an environment, like I'm going to be on an airplane, okay, or something, yeah, I'm going to up it a little bit because I don't want to participate in the Cygnus world. So anyway, thanks for the question with that, Scott. Who else has thought, comments, or questions tonight?
Hi, Keith. It's Linda in Peterborough.
Yes, Linda.
I have a friend who's on kidney dialysis, and I'm wondering, is there any concern with him using platinum because of the creatine?
You don't know, Dr. White? Your thought?
I'd be more
hello.
cautious. I'd be more cautious with that. I'd just switch to the Immunocal and be sure.
Okay.
Yeah, this is Suzette. I have a brother that's on dialysis, and they highly recommend the Immunocal. No platinum for dialysis people at all. Was his doctor and his surgeon. Highly recommend it because it's the most bioavailable, but no platinum. Just saying.
Excellent.
That's why people want to be on these calls, because you get all this really good firsthand knowledge. Great question, great answer. So,
Thank you to all. Thank you.
all right. Who else has thought, comment, or question tonight?
It's Lori from Sandy Lake, Manitoba.
Yes.
My son is suffering with severe headaches. Now, he's taking 4 platinum a day. Should he be doing anything different?
Are they migraine headaches?
Pardon me?
Are they migraines, or do you know?
Yes, they are.
Then I would get some extra sharp, because now you're going to take me off to my magic elixir.
Okay.
The nectar of the gods, the incredible product, okay? And by the way, in case you've not had it, it tastes awful. Okay? If you like licorice, you won't mind the taste of it. I do not like licorice at all. Okay. I have never willingly ever eaten a licorice stick. Okay, never, because I don't like it. But I take extra sharp every single day. I don't take it for the migraine headaches, but I suffer from ocular migraines. Ocular migraines means it affects my vision, but there's no pain. Okay, and it eliminates it. I probably have my friend Mike, Lois, Wally Kralik. Those are the ones just right off the top of my head that were severe migraine sufferers. Extra sharp eliminated their migraines.
Okay.
I don't mean it helped them. I mean it eliminated.
So how much a day?
Probably what I would do with him is I would do a half an ounce about 3 times a day.
Okay.
Okay. And then after that, maybe a half an ounce every day. And then this, what you're going to notice with it is take it every day and you won't have the headaches. Okay. And that's a bold statement. Okay. And it doesn't apply to everybody, as always, with the caveats. And not everything does everything for everybody. Okay?
Right.
But he wants to take it every day. Now, there's a lot of other benefits from it. The reason it does that, okay, the reason it helps with the migraine, and the company just goes nuts, and that's why we put the caveats in here. This is exclusively a training call, not for customers, not for potential distributors. What Extra Sharp does is it increases the amount of oxygen in your blood supply. Okay, so it actually is, so just like if you have a migraine and they give you pure oxygen, the migraine goes away. Well, Extra Sharp is working somewhat in that same way, as it's increasing the amount of oxygen in the blood. Now, K21, okay, has a similar effect, but it's not quite as effective. Okay, so if for some reason they're saying, I don't want to take the Extra Sharp because of the guaranamine and whatever, which, that's a decision they can make. The K21 has similar, it's not quite as much, but they're going to need to take a lot more of it.
Okay.
But that's what I would do. Your thoughts, Dr. White?
Yeah, I have the same ocular migraine as well, and I don't have it at all when I use my Extra Sharp. I get my first thing in the morning, an ounce of Extra Sharp.
Okay.
Yeah.
Great. Thanks very much.
Okay. Great question. Like I say, that's why, because everybody says, why does Immunotech have all these other products? Why? Because we have who do you know that has stress in their life? PNT 200, our Serenity. I'm sorry, their Serenity T. They changed the name on me. I apologize for that. But the Serenity product, okay, it's as effective as diazepam, which is known as Valium. It's as effective as Valium for reducing stress. But there's no side effects to it, and there's no contraindications. In other words, if somebody takes the whole bottle, a baby takes the whole bottle of Serenity, it's not going to hurt them. If somebody takes 4 or 5 of them, and then socially somebody comes by and they decide to have an adult beverage, there's no interaction. Okay.
Okay.
There's no contraindication, so that's why that's a product that we haven't talked about in quite a while. But that's a product everybody needs to have. Okay, with stress in their lives, because stress is a killer.
Right.
So we have that product. The calcium, we don't talk about it as much. But anyway, we want to go back to the Immunical, and we want to go back to the patents, of this immunotherapy, the Nobel Prize in medicine just being awarded for somebody that piggybacking on Dr. Budo.
Keith, on
Yeah.
the getting oxygen into the system, cancer cannot live in an oxygenated body. So
Right.
why wouldn't that be a good addition to the platinum?
Well, it would, because I take it and I recommend it to everybody, because they're gonna feel better. It's gonna give them an energy boost. Okay, and not an energy like caffeine. Okay, because one of the things you look at when you look at the label on Extra Sharp is it has guaranamine. Okay, keyword guaranamine, not guarana. Guarana is a stimulant. It's a high level caffeine. Guaranamine is a different. It releases differently into the body, slowly over a long period of time. Whereas caffeine from guarana is a quick release. It's like so you get a rush from it. You're not going to get a rush from Extra Sharp. Okay, that's why when somebody takes it, it's about 10 or 15 minutes, and all of a sudden, you say, "Gee, I feel better," and 4 or 5 hours later, you go, "Huh, okay, I guess I'm starting to get a little." You don't have the down, you don't have the rush going up, and you don't have the crash on the other end. But Extra Sharp is something that I think is, an incredibly important product in everybody's, a cabinet of nutrition. So, okay.
I love this product.
Oh,
Keith,
yeah.
With you and your help, we did a lot of seminars, and if it wasn't for the Extra Sharp that helped everybody feel more energized sitting through a seminar and being in, by the way, Las Vegas, and wanting to party all night and then sit through a seminar, Extra Sharp, everybody, all the doctors and participants in the conference would all come back to our booth time and time and time again. It was one of our number one sellers because you could experience it and feel it within, like you said, 15 minutes. So love the product. Take my Immunocal Platinum and Immunocal. I take all of the products that we have in our library every day except Magistral. But that's another story.
Okay, thanks, Janice.
Okay, my
Thanks for that.
pleasure.
Keith?
Once again, yes.
Keith, this is Rocky.
Yes, young man.
Listening for the rest of the previous part of the call, I have some friends who are going through chemo and radiation and stuff like that for cancers. Should they be doing regular Immunical only, or the combination of platinum and regular?
I would be the platinum. I would be doing 4 platinums a day.
Okay, gotcha.
And when you read the article there, they talk about, because this immunotherapy that they're talking about in the article that you're going to read is that they're using it to make the chemo and the radiation more effective. Okay, they're not doing it instead of; they're using it as an adjunct. That was the original research that was done with Sloan Kettering and Immunical all those years ago that we never talk about. Okay, is it was used as an adjunct therapy at Sloan Kettering Cancer Institute with Immunical and Immunical Platinum with patients that were going through chemo and radiation therapy. They were more effective. That's why when somebody's taking Immunical and Immunical Platinum, we can't guarantee this, but the reality of it is what we've seen all the years. They don't get sick. They're not sick to their stomach. They don't lose their hair. They don't have the weight loss. They don't look like death warmed over. Okay. Because they stay on Immunical and they don't suffer from that. 9 out of 10 people that take Immunical that do radiation and chemotherapy never lose their hair. Okay, never lose their hair. Well, that's just almost unheard of. Okay, and they don't. And then the other side of it is they don't lose the 20 or 30 pounds. And in some people, that wouldn't hurt them, but in most people, that's a pretty significant weight loss. and that wasting disease normally kills the people because the wasting diseases hit them, and then all of a sudden they get the flu or they get pneumonia or something, and it takes them out, even if the cancer doesn't. The chemo and radiation, the doctor says, you know, the chemo and radiation is working well, and the next thing you know, the person died, and they go, what happened? Well, they contracted pneumonia. Okay? Well, that's because their immune system was overwhelmed. That's why we never tell somebody, do not do whatever your oncologist tells you to do. But what you want to do is make sure that they, as an adjunct therapy, that you're using Immunical and Immunical Platinum in that process.
Well, you had a lady on here on the call a few weeks ago that had reported that kind of thing with using Immunical during her radiation and chemo and how the great results, but
Yes.
I could not remember whether she used
Go
both
to
or one.
xyztools.com,
Right,
XYZ Tools on there. You can go back over there, and Linda Weldon's video is there, and you can listen to Linda.
Cool. All right. I've forgotten her name even. Okay, thank you.
Okay. Well, see, there you go. Not enough Immunical Platinum. Yeah. And now there's this product called Cogniva, Rocky. You know. Anyway, we'll go on. Who else has thought question tonight?
Cogniva, I tried a little of it. My brother Lee gave me some, and but I didn't use it very often, very regularly.
Don't leave me open statements like that. I'm not that nice a guy. All right. Who else has thought, comment, or question this evening?
O'Brien here. Ladies first. Go ahead.
Now go ahead. Yes, Bob. Go ahead.
Okay. I've been taking 4 or 5 of the Immunical for the last 2 or 3 months. I'm going in Tuesday for the surgery to replace the valve in the heart, aortic valve. So between now and Tuesday, what should I boost it up to?
I think you're good to go. You've been doing well with this.
Okay. Is it okay to mix the regular with the platinum to do the 6, or just stay with the platinum?
Yeah, you're fine. Why don't you tell everybody a little bit of story, because you've been taking Immunical and Immunical Platinum now for how long?
About 10 years. I had quintuple bypass surgery 12 years ago. When I got on the medication, I became somewhat stupid. I could not remember anything after about 6 months on the meds. And I went to the doctor and mentioned that, and he said, oh, well, the medication will do that to you. And I said, well, I'm done with meds. So he pleaded with me not to get off the meds. But I went online, and I discovered Immunical and gave it to him and said, I'm taking it regardless. And says, well, let's just watch what happens. And within 7 months, watching my blood work, he said, well, I see no reason why you can't keep taking it. And within 7 or 8 months, I was off all medication. I've been off all meds for the last 10 years, and I've not had a cold or I might get a little sniffle now and then. And I'm around people who are sickly, and I've been fine for the last 85 years of age, and that's where I'm at. So I'm going in for the valve, and that's something just of age. It can develop, I guess. I don't drink, don't smoke, so I haven't abused myself that way for a number of years.
Next thing you're going to try to make us believe you didn't chase girls, but we're not going to believe that with that Irish leprechaun. All right, thanks, Bob.
Well, I've retired. I retired somewhat from that. Yes, only because I fear for my life.
There you go. Barbara,
so what, Bob?
Put a knot on that head.
You have no problem at all with that. She wouldn't. So anyway, so getting back to, I should take as far as what mixture of the regular and platinum do you recommend?
Yeah, just whatever. Just take your 4 or 5, whatever you're taking for a day. That's fine.
Okay. All right. Now,
all right,
can I take them in the hospital?
Yeah, I would.
Oh.
Nuisance to do, but take it. Yeah, I would.
Okay. All right. Thank you.
All right. Who else has thought, comment, or questions as we start to wrap up tonight's call?
Hi, this is Patricia from Saskatoon.
Yes, Patricia.
What can help type 1 diabetes, that is with the insulin injections? A young man around 30 years old just got diagnosed.
Well, the thing that I would look at, okay, is the pancreas and rebuilding the pancreas and so forth with that. I don't know where we're going to end up with Immunical. We've had some reports, Okay, but the main thing that what I would honestly be looking at with that is mostly with the diabetics, that they're having a situation where they didn't know I had a friend of mine that has since passed away, but she was insulin dependent diabetic from the time she was 17. She made it into her late 60s, but she had no feeling in her legs. She could walk, she could do the thing, but she actually stood on a grate over a furnace and burnt the bottom of her feet, blistered them, and didn't have any feeling of that. Now, that put her in the hospital for the better part of 6 weeks because it got infected. Okay, and so the thing I would be looking at with the Immunical is, I don't know what it's going to actually do for the insulin-dependent part of it, but there are so many risks associated with diabetes of people developing, they cut themselves, but they're not aware of it, they get an infection, they're not aware of it because they're not feeling it. And I would be looking at certainly get him on, a young man, at least one package a day if he's under the age of 35. If he's over the age of 35, I'd look at 2. Your thoughts, Dr. White?
Yeah, it has to do with the periphery stuff. It's not so much the diabetes itself, but it protects you from the ancillary things that happen. So it protects your arteries more. It protects your the nerves, the ability for your body to function. So it is what it's doing mostly is protecting the body from the ill effects of the diabetes itself.
Yeah. Okay.
Okay, thank you.
Okay. Well, one more thing I want to put out: if you go to XYZ Tools, the website now, some of you may or may not have ever seen the brain study. If you scroll down, there's a link there, a button. You can press that button, and it will open up the PDF of the brain study that we talk about. Also, right below that, there's a little short video that I did talking about what's in that study that's so important. Okay, and that's on xyztools.com, and like I say, that's up there. If you scroll part way down, you'll see the little picture of the PDF and a little arrow, and there's a thing that says PDF brain study PDF. Just click that button, and then it'll open it up, and then you can print it off. So that's there as well, because that brain study is profound, very profound, as to why somebody needs to be taking Immunical who doesn't believe they have a problem. They're healthy. Their kids are 13, 14, 15 years old. The kids are healthy, but the kids play sports. The number one cause of concussions is junior soccer. Okay, if some child is playing junior soccer, they need to be taking Immunical, just absolutely guaranteed. And once again, when you see that study, it's there, and you'll get that as well. So it's not just the cancer, it's not just the diabetes, it's not just all the other reasons as to why we take it. Once again, when Sandra and I started on the product 23 years ago, we would have told you we were healthy, because that's what we thought, until after we'd been on Immunical for a short time. Then we realized prior to that we weren't healthy, because we'd grown accustomed to certain things. All right, who else has thought, comments, or questions as we finish up tonight's call?
Hey, Keith, this is Manuel. Quick comment on regarding when to take Immunical. I give it to my mom just before she goes to bed, and she says it seems to help her get a little bit better night's sleep. So
yep,
just throwing that out there.
Too. And there's some reasons for that as well. Okay, great point, Manuel. You're a good son. All right. So, another person, a lady first there, Lee. I think there was another lady with a question. Maybe not. You must have scared them off, Lee.
Well, I scare a lot of ladies off. I'm sorry. Hey, right, the comment that you just made reminded me of something that you mentioned to me right when I first started taking Immunical. You asked me, so what has it done for you? And I had to think about that because, as we know, all of us have different problems, and since it's helping your immune system across the board, each of us are going to see things a different result up front.
Exactly, and you may not even remember them. That's why years ago we made a little form with the Extra Sharp, actually, where people, check the box, how do you feel today? And they had a list of things. And then, the idea was take Extra Sharp for 2 weeks, go back and re-see the form, and then go back at the end of 30 days, and then at the end of 45 days, take it and see what has changed. And that's what I would suggest here. If you think you're healthy, I still come back, to my friend Robert, that when he started on Immunical, he looked like the guy you see running on the beach with his shirt open, okay, and in great shape, 2 or 3, 3-4% body fat. Did yoga in a sauna, for goodness sake. His wife was a Pilates instructor, or is a Pilates instructor. Great shape, all the things with that, and in their late 30s, and saying, we're healthy. I'm saying, I need you to take this Immunical Platinum. Try it. There's nothing wrong with them. And so, to quiet me down, I'm not going to say to shut me up, but to quiet me down, they got it and got on it. And about 10 days or 2 weeks, Robert calls me, and he goes, well, he says, because we're staying in contact, and I said, so what do where are you at? And he goes, it can't be. But he said, when I work out, he goes, I've got a spot in my shoulder that hurts. And he goes, it's bothered me for well over a year, okay, when I'm pushing through some weights. And he goes, it's gone. The pain's gone. He goes, it has to be coincidental. And I go, no, it's not coincidental. It's because of the anti-inflammatory. About 5 or 6 days later, he called me back, and he goes, okay, you got us. He goes, his wife's heel pain was gone. She had heel pain, and her heel pain had disappeared. Now, these are two people. This is, we're not talking about cancer. We're not talking about whatever. We're talking about nuisance. Okay, when he's working out in the gym, he's got this spot when he's pushing through the weight that his shoulder hurt. Okay, she had heel pain. They start taking one packet of Immunical Platinum, and that goes away in less than 3 weeks. Okay, is it worth $3 a day not to have that pain? Absolutely. It's cheaper than a cup of coffee at Starbucks. Okay. All right. Who else? Anyone else? Thoughts, comments, questions as we start to wrap up the call? We got a lot of people on the call, so don't be bashful. This is your opportunity. Okay.
I do have one question.
Yes.
Can I ask a quick question? Wait. Okay, my name is Pat, and a lot of people that are trying to stave off disease that maybe don't know about Immunical go on an alkaline diet.
Okay, well, Pat, you're getting some feedback.
Oh, yeah.
Okay, try that again. You talk about the alkaline diet for alkalizing your diet. Is that what you're trying to do?
Yeah. No, so with taking Immunical, do you people recommend changing? Well, I mean, it's good to eat healthy anyway. It's good to eat grass-fed beef and so forth, or just. But do you recommend, or is it necessary to change up the diet a lot for Immunical to be effective, or just stop drinking coffee, or
Eat your normal life. Look, everybody needs to eat healthy, and like I share with everybody, that only costs you about $1,000 a month per person to eat healthy. If you're spending less than $1,000 a month per person to eat, you're not eating healthy. You're just thinking you are. Okay, because eating healthy is real expensive, as we know. Yeah. Okay, but the point that I'm glad you brought this up, because we haven't talked about this in a long time. When you look at Immunical Platinum, okay, and when you look at what it is, it's 10 grams of Immunical plus an additional 2.5 grams that's added to it of cytokine modulating protein, which is more effective than lactoferrin for treating cancer, and redox modulation factor, RMF. The RMF is some minerals that are added to it. What these minerals do is it alkalizes the cells. It changes your cellular pH.
Okay.
From acid to alkaline. That's the magic that Dr. Droge, building on what Dr. Bunos had done. And Dr. Droge came from the German National Cancer Institute. He was a member of the Max Planck Institute, in Germany, which is where Albert Einstein was at. He was also an adjunct professor of medicine at Harvard and published over 280 times in peer-reviewed journals. So when they came out with the Immunical Platinum, they added the cytokine modulating protein and the redox modulation factor to Immunical. So there's 10 grams of Immunical plus 2.5 additional grams. And that's the difference between the two products. But the main thing is exactly what you're talking about, is it changes the cell. The key here is it changes the pH of the cell. Okay?
Well, hallelujah.
Yeah, because what you're looking at, if you're doing a saliva or urine test, it tells you what used to be. It has no current data whatsoever. Okay? And that was why I had some doctors that really, I felt bad for the guy that was trying to tell them they needed to drink alkalized water, and they were telling him that you can't. Okay, that you cannot consume enough. You can do it. The only way you can change the cellular pH is through food. Okay.
Yes.
Because and that's where you've got this redox modulation factor. Because if you drink alkaline water, okay, and your body is immediately going to dump acid into it. Immediately to get your stomach back acid. Okay, it's going to do it instantaneously. And if you drink more of it, so your body can't overdo it, you will be rushing to the porcelain throne, okay, and sticking your head in it because you're going to be throwing up. And this was the doctors that were, and I mean, these were some high-powered UCLA medical professor doctors that were talking to this guy. And I felt bad for him because he thought he knew a lot about alkalized water, and they're going, you can't do it. You can only you can do it with food. There's foods that will help alkalize your body. Okay.
Yes, and yeah.
Yeah. So, but that's why the platinum is so much better. When I say so much better, the platinum is the preferred product for people with cancer.
Yeah. Okay. Well, it's worth asking about because it's impossibly perfect. It's impossible to be perfect with food. Some people are really good at it, and but there's variations of what you should eat and what you shouldn't. But I mean, good fruits and vegetables, organic or grass-fed products. I mean, those are definitely a plus. Our world is very toxic, and things that aren't good are in our foods. So it's worth a try anyway.
Healthy food. The stuff that's not good for us is cheap.
Yeah, right.
Cheap and plentiful.
Yeah.
That's not good for us. So,
yeah.
absolutely.
Well, thank you.
Thank you. And that's what these calls are for. It's for you guys, for all of us to interact and learn and with that. So great question. Glad you brought it up. Anyone else this evening? Okay, Dr. White, your closing thoughts?
No, I think we've done pretty well about exposing here's the incredible thing. It really is incredible. We've had this in our hands for 23 years in total, and we're still keeping it a secret. So it's time to let it out of the bag. This is a spectacular thing that we've had in our hands, and it has such enormous value, and it doesn't cost $1 million a box.
There's nothing more useless than a therapeutic breakthrough against cancer that people don't know about. Thank you for being with us this evening. We appreciate all of you very much. Once again, next Wednesday night, same time, go to xyztools.com. Make sure you're getting the emails about these calls. With that, thank you all for listening.